Dear colleagues, in this video we are going to talk about the full field ERG. Let's get started. Definition. The ERG or electroretinogram is a diagnostic test that measures the electrical activity of the retina in response to a light stimulus. What is the principle? The ERG arises from currents generated directly by retinal neurons, combined with some response of the retinal glia. ERG is an objective measure of retina function that can be recorded non-invasively under physiological conditions. Overall, it measures the function of the photoreceptors and other internal retinal cells. What about the technique? The ERG may be recorded using a thin fiber electrode that is placed in contact with the cornea or an electrode embedded in a corneal contact lens. These electrodes allow electrical activity generated by the retina to be recorded at the retina surface. The ERG can be elicited by diffuse flashes or pattern stimuli. What are the types of scans? The International Society for Clinical Electrophysiology of Vision, the ISCEV, introduced standard waves for different forms of ERG recording. There are mainly 6 protocols, although in the past they used to be 5. The current 6 protocols of full field ERG are: first, dark adapted 0.01 ERG, which is a rod-driven response of bipolar cells. Number 2, dark adapted 3 ERG, which are combined response arising from photoreceptors and bipolar cells of both the rod and cone systems, although it's rod dominated. So the first one is a rod-driven bipolar cell. Second, a combined response of rod and cone, but more rod. And the third is a dark adapted 10 ERG, which is a combined response with enhanced A wave of photoreceptor function. Fourth, dark adapted oscillatory potentials, which are response of the internal retina or hemicrine cells. Fifth, light adapted 3 ERG, which is a response of the cone system, as well as the light adapted 30 flicker, which is also a sensitive cone pathway driven response. The main indications of ERG full field are retina dystrophies. The exam allows us to differentiate and exclude patients who do have and do not have retinal dystrophy. In addition, you can direct your differential more towards rod or cone mediated retinal dystrophy. Other indications of full field ERG are retinal inflammation or infection, cancer-associated retinopathy, medication-induced retinopathy, retinal detachment, lymphoma, retinal vein occlusion, unexplained visual loss, preoperatively for patients with cataract when you cannot examine the retina due to the opaque media, albinism, or for example retinal trauma. In summary, full field ERG is a very important exam for ophthalmology and retina practice. I hope you like this introduction, and we are going to address this topic in future videos. See you next